This healthy living tip is brought to you by the Christ Hospital.
A hysterectomy is when the uterus, which is the womb, is removed, and it's usually done because of a surgical indication. Hysterectomies are a fairly common procedure in this country. Approximately 300,000 women have hysterectomies every year. Probably one of the most common reasons for a hysterectomy is uterine fibroids, which is an abnormal growth in the size of the uterus. Women can have pelvic pain due to infection or a disease called endometriosis, and that indeed is another common cause of hysterectomies. Women who have had multiple children sometimes have a disease or condition called prolapse, where the uterus begins to fall out, and in that case the uterus has to be removed. And sometimes the uterus is enlarged and causing stress urinary incontinence, or the leaking of urine, and we remove the uterus and fix the bladder for that reason. There are a number of different types of hysterectomies. There's a total abdominal hysterectomy, where the uterus, the entire uterus, is removed through an abdominal incision. There's a supracervical hysterectomy, in which the top portion of the uterus is removed, and in that portion of the uterus, the cervix, which remains in the vagina, is left in place. Now, you can do a hysterectomy through a large scar, or you can do minimally invasive surgery, where you make a tiny little incision about the width of a pencil through the navel, the belly button, and you can actually remove the uterus and various organs through those tiny little incisions. There's also a vaginal hysterectomy, where you just go in through the vagina and remove the uterus that way. The minimally invasive hysterectomy is one of the best options because the patient is in the hospital for approximately 12 to 24 hours. She goes home either later in the day or early the next morning. Most of the patients go back to work in 3 to 5 days. There is less pain, less scarring, less discomfort during minimally invasive procedures. All of these options are available at the Christ Hospital because Christ has remained technologically advanced and in the vanguard. We have all of these options available for patients, and each and every doctor can assist their individual patients and decide what is the best procedure for her. Women need to have annual physical examinations. They need to see their gynecologist once a year, have their pap smears and their breast exams, and between their visits, if they have any type of pain or discomfort or a menstrual irregularity, once again, they should call their gynecologist and make an appointment to see them.
For more information about women's services, visit thechristhospital.com/women.